Holy guacamole, guys. Monkeypox is an emergency. A public health emergency.
We are going to do everything that we can to end this outbreak.
If you aren't already freaked out by the government declaring this public health emergency, please take a look at these pictures. This is monkeypox, an extremely fatal, excruciatingly painful disease currently affecting 7 out of the 5 members of your family. Don't be alarmed. Symptoms will subside shortly after death, and your dead body will only be contagious for the next 50 years. Realistically, what I just told you about monkeypox is a little overblown. The current numbers pertaining to monkeypox are as follows. The total number of confirmed cases worldwide is 31,799, and the current number of fatalities is 12, which means monkeypox has a case fatality rate of 0.04%, or 1 death per 2,650 cases. When you compare this to, let's say, the US fatality rate for the Wuhan virus, which was around 1.1%, you're inclined to take a sigh of relief. But you shouldn't, because this is a public health emergency.
The U.S. declaring a public health emergency.
A public health emergency.
A public health emergency.
A public health emergency.
A public health emergency of international concern.
This emergency is serious, and what better way do we have to understand the severity of this disease than to hear from those who have struggled and are struggling with this virus firsthand?
It hurts to exist. From the time it started, it's just progressed and gotten worse and worse. Every sip, every bite, it's just like, oh, I can't, it hurts.
Are they as bad as they look?
So much worse, so much worse. Anytime it grazes something or touches something, it literally feels like someone's taking a potato peeler to your skin.
I had swelling so significantly, not just in my lymph nodes, that my right ear became swollen shut, along with fever, along with headache, along with body ache.
Brutal. This disease is primarily affecting men who have sex with men. In other words, gay men are seriously being affected. And according to the CDC's enhanced monkeypox case detection and reporting system, 99% of cases were among men, and among men with available information, 94% reported male-to-male sexual or close intimate contact during 3 weeks before symptom onset.
You might be gay. You might be gay.
Another report from the New England Journal of Medicine indicated that of the 528 infections diagnosed between April 27 and June 24 at 43 sites across 16 countries, 98% of persons with infection were gay or bisexual men. So it's pretty safe to conclude that this is not actually a public health emergency, but instead a gay male public health emergency.
This is a pandemic of the gay men.
But there are those who would push back against this assessment.
We need to recognize that this is not transmitted from and between gay men. This is transmitted between people.
Trying to put the blame on a certain group in society is disgusting. Keep your homophobia in check.
We have to move past moral judgments, and we have to start following science.
Well, I'd say talk about science and talk about facts. Don't talk about communities. Don't stigmatize them.
Okay. So we're expected to look at science and facts. Well, we've already looked at the facts. This disease almost exclusively occurs among gay men who are sexually active. And we've kind of already taken a look at the science. But to refresh, monkeypox can spread to anyone through close personal, often skin-to-skin contact, and this direct contact can happen during intimate contact. So when we look at the science and the facts, we can conclude that this virus, although spreadable to anyone through close skin-to-skin or intimate contact, is almost exclusively spread and contracted by gay men. Or should I say men who have sex with men? Actually, I think I'll stick with using the term gay men. Now that we've established how the disease is spread and who's doing the spreading, how might we combat this issue? Well, I have a suggestion. What if individuals spreading the disease stopped engaging in actions that caused the spread? Some might call this celibacy, others might call it avoiding sodomy, still others might call it men no longer having sex with men. You can call it whatever you'd like, but maybe this is a sign to stop engaging in degenerate behavior. Ditch the butt stuff.
Do you like it as much as you like men's butts? What? Because you're gay?
And save us from this public health emergency. And I'll leave you with this. We should not only stop this behavior for the well-being of humanity, but also for the sake of our pets.
And I also checked with my vet, who did a lot of research and said it's extremely, extremely unlikely. And he had actually said, get Pebs back. You need her to help you feel better. And so I did.